Well, we are happy to be here on behalf of Pype and myself. We like to peel off the layers and let them thrive. In other words, we take a hospital, but the healthcare landscape, and we try to peel it off. And what shifts are occurring today in the total real estate portfolio in healthcare in the Netherlands. But Saskia already said, Roy and I indeed discussed what changes will occur in our landscape on the beach in San Diego, inspired by Radboud, of course, Lucien van Engelen, and exponential medicine. As real estate developer, you always make plans, but like a boxer, Mike Tyson said, everybody has a plan till they get punched in the mouth. So it takes a lot of guts, courage, and perseverance to continue with the plan to get and achieve your goal. Today we simplified our total healthcare landscape in a rectangle and put all the patients, clients for the care, and renters even today together in this rectangle. So from a patient, client, or renter's point of view, what will change in your environment? And we made the classifications from queue assistance, small issues that can be dealt, for example, at home, or just one visit at the GP, chronic diseases, sick, emergencies, and mental. Especially these last classifications, because already in the Netherlands, almost 10% of our population has some mental issues. Small ones, big ones, or even to a higher level, chronic. For the Dutch here, we all know that we have healthcare lines, if I may say, from 0 to 3. And to simplify this, 0 is home, 1 is our general practitioner. The second line is hospital, and third are the residential care facilities. For today, not the university medical centers, because Daniel, the next speaker after us, will dive deeper into this subject. And even more to simplify this was even one of the most hard tricks. We added the total volume of 75 billion euros to this. So where are the expenses in the total healthcare market? And a part of this is all spent on real estate. This is the situation today, 100%. And I will ask you to keep this picture in mind, because now we compare this with the influences like policy, demography, lifestyle technology, medical technology. And we don't dive deep in technology, because you saw this morning already a lot of technologies that will occur today, tomorrow, but especially in 5 years' time, where in technology 5 years is, well, let's say a century. In our world, 5 years is, well, let's say, is tomorrow. So it's a very difficult combination. When we take a look at policies, our government is directing and concentrating healthcare. We as patient, client, or renter do have to take our own responsibility. And this is money driven. That sounds bad, but that's not actually true, because a lot of us have to be given an incentive to move the mindset. When we take this in mind and take a look at the volume in our perception, our total expenses can drop down by 15% to 85. Actually, we don't see a shift in where we spend the night or even live. Demography, well, we just skipped the line of 17 million people, I think 3 months ago, and will increase. We still get older and want to live healthier. But sometimes shock occurs, for example, like immigrants who take also other kind of issues with them where we have to deal with. The other way or the other way, it doesn't matter. And we take this into account In our calculations, we, in the next years, will spend more in healthcare for 15% and will goes up to 115. Lifestyle, the difficult part, we all know when you eat healthy, you maybe live longer and you feel right. Exactly the same story as what Harry told us, but your self-awareness, well, after tomorrow we have to be careful with this word, I learned, but we see is that when you live healthy, you will live longer, much more healthier, and our total expenses can drop down, but also the need to live or the need to build in your hospital will change. And that will decrease dramatically our total healthcare market landscape and expenses, and also shifts from one category to the other one. When we take a look at technology, there are technologies already available, for example, an Apple Watch that monitors you every second of your living, of your day, at night. It's what you want to decide. It speeds up. And for example, the artificial intelligence or even the augmented reality helps us and support the decision makers and make their decision better. Do we build this hospital or not? And what we like to say is, because we're talking about patients a lot, but indeed, where is the patient? And patient is also a passive approach. So we like to introduce also the action, not the patient, but action. So the proactive patients in the future who monitors himself and steps to the podium when problems occurs. This will take this into account will make two major shifts. One is that what we see is that our healthcare services, from hospitals to nursing homes, etc., will dramatically shift from the second or third line to our homes, for sure. It's already all going on, even pushed by our policies. But this is just the first step, in our opinion, and our GPs will get a very busy job. And the total volume can come down, so our healthcare here in the Netherlands will stay accessible and also affordable. When we take a look at medical technology, it will be more personalized, smaller, and for example, medical treatments, a small nanotechnology pill will drop the solutions where the problem occurs. And you may ask, what the hell is this doing with real estate? Well, you can personalize it, so it's a home issue. And you don't have to go at that moment, for example, to a doctor. And also, therefore, we think that the total volume can decrease. So, and that sounds strange as a real estate developer, yes, my job in the total volume will come down, but that's also the drive that we have to do. When we take consequently and take a look at all the opportunities, we see that the opportunities are here is monitoring, prevention, even we think fewer diseases. The diagnostics at home will increase dramatically, and the role of our GP and polyclinics will differ. And what we say, and will be even the first time right, supported, for example, by an IBM Watson, will take place. So a lot of functions will come to our homes, and that we have to take that into account, especially for our home builders. And this means that there is a distinction that becomes gradual. And then the question pops up, I showed you the patient earlier, is this a new patient? And this is where Roy takes the podium. Roy.
We don't see a new patient, still the same patients, 2026, but maybe this patient has swallowed a nano-size device which monitors that patient continuously. He shifted his mind about his self-awareness and willing to know what is going to happen with him and choosing his own care path. But at the end, still the same patients with a totally different mindset and maybe a totally different technology in or on his body. If you see what the impact will be on the landscape, we first had this distinction in homes, first line, second line, third line. It's very distinct between all those lines, and we think it will shift towards far more gradual situation, moving from living home with a connection to living home, staying home longer with assistance, with personal assistance, and in some occasions in your lives, intervention. And we look at the volume, if you try to make the combination of all the influences, as Robert has shown us, maybe in 2026 the volume could drop to 60%, divided over the landscape we've been drawing with you in the last 10 minutes. We see a shift from second line to home situation, and we see a drop in the second line hospital environment. Sorry, here we combine, if we show you the two of them. The first one Robert was drawing about 2016, and maybe the new one in 2026. You should definitely shift from second line to the home situation. But if you try now, this is the real estate track, to see what the effect will be on real estate, I want to draw with you in the next couple of minutes the movement from 1, 0, 1, 2, and 3 to a far more assisted and connected healthcare situation from a real estate perspective. Today we have our homes where we live, sometimes assisted. Second, we have centers where people take care of cure and refer us to what we know as the big hospital, with all its facilities as wide as possible, with its hot floor, with its factory, with its hospital and with its office in it. And finally, we have residential care, either on a small scale or on a large scale. How will this shift? I think the first thing we will build is not something physical, it will be something virtual, a health community which takes care of us, which monitors us, maybe on a global scale, what Watson is doing, towards a more local scale, where an alarm center is just helping you to notice if something's going wrong with you. And that health community will take care of the real estate underneath it. First step we take is that assisted living will be moving to connected living. Second step we take, if we start at the end with residential care, is it will shift to our homes, connected and assisted. And on the other hand, we'll build small-scale dwellings where cure in a group level can take place. The next step is what is going to happen with the hospital. I think that's really the place, or we think is really the place where the peeling off takes place. This hospital will probably fall down into 3 pieces. And actually there are 4, because we made one big mistake, and at the end maybe you can show us what the mistake in our presentation is. The hospital, at first, to start with the most complex part, I guess will drop down in centers for complex treatment. I think it combines with the 2 ICU that Harry was drawing, just the intervention centers, and from the intervention, the necessary beds around it, IC beds, mother-child situations, which has to be taken care of in the emergency situations. The staying in the hotel, or the long staying in the hotel, will shift towards time out and recovery situations, where you can stay for a longer period, not maybe the 3 days you want after your surgery, but also maybe we are going towards a society which takes us 50 years to work, from 20 to 72 in my occasion. And I think in those 50 years you will need some time to time out. Either you choose by yourself, or otherwise not chosen by yourself, because we are creating a burnout society with high pressure and high demand. So also from the home situation, I guess that time out and recovery, where care and cure will come together in both of them. And finally, where do we leave all those high knowledge, high educated specialists and medical people? I think they will group together in what we have called centers of excellence, who take care of complex diagnostics, who will take care of the incidents, and who will try to push medical knowledge a step further. And in between, centers for simple treatment, close to you, in your neighborhood, with GPs working together on a holistic approach about not only what is happening to you on a medical basis, but also in a psychological basis and your social environment, your home. And from a real estate perspective, which guys are already knocking on those doors of this new landscape? I think the cloud is clear. Google, Apple, Salesforce, they're all taking care of that cloud. The private house, I guess that Robert and I probably will keep our house in our own possession. So a big part of healthcare landscape is shifting to a private possession by us. Dwelling in care on low complexity, high volume, people like Facilicom, ISS and Atos are knocking on that door to take over because they know how to deliver something in the future care on a small scale distributed way. Finally, after the next step, the timeout and the recovery, Jan was introducing the knowledge in the hotel world is just about hospitality, making you feel served, treated in the best way, have a nice meal at the moment you will, if you want it. Those simple treatment situations, some people are guessing that supermarkets will take over, that digital communities will take over, together with, and there's in Dutch, huisarts, with the GP, helping them. Those centers of excellence you see that people are trying to organize the combination between medical specialists and on the other hand, medical suppliers or technology suppliers like the Siemens and Philips of this world. And they try to focus on one point, like an Alexander Monroe Hospital, just focusing on breast cancer, nothing more, to make sure that they get a 9.0 review by their patients. I don't see any complex treatment centers or any hospitals focusing just on the complex treatment and the beds around that complex treatment. So we left that part empty. So what to do? I think if you're a government, we're happy that Edith Schippers is still continues to focus on e-health. If you're a hospital, I would say minimize. If you're a healthcare organization, try to find the connection with home, and it even counts for the hospital. If you're a technology developer, everything this morning is about acceleration. If you are a real estate investor, I would watch out. Robert, if you're a developer, I think you are. Change course. As an architect, we should quit. And as a master builder, René, I'd like to hear from your presentation what are you doing with this battlefield. So 2026, still the same patient, far more clever, far more informed, and far more in self-control. And I hope that the savings we're making from dropping from 100% to 60% in budget, that those 25 billions will stay in the system to have more time to care for this patient and have time to talk with him what is going on at home, at school, and with their kids, and not only about the breast cancer or the broken leg they have. Thank you.